Forcing medical staff to work during the strikes could harm care, NHS providers have saying. I'm going to read into this a little bit more from The Guardian, guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from The Guardian with the headline that forcing medical staff to work during strikes could harm care, NHS providers have said. The new anti-strike laws risks damaging relationship between staff and employers, the hospital trust leaders have said. Now, we've talked about this. It's been talked about before, these anti-strike laws and the damage that they could cause, and the thing is that they tried to say, well, other nations have such laws as well, but the difference is they have like a minimal service level. But the thing is that the NHS is cut so much to the bare bone already, so few down, that this is not going to fix the problem. This is not going to fix the issue. This is essentially an attempt to stop workers from standing up for their rights, essentially trying to deny the right to protest, the right to free speech, the right to fight for better pay, better terms and conditions. It's essentially what this is. And while it is important that the National Healthcare Service maintains a level of service, and nobody is questioning that there needs to be provided a service to people, it is extremely underfunded. It is extremely underfunded, lack of staff, lack of equipment. Excuse me. It's just not been there for the last few years, and in particular because of austerity. Excuse me. It's just not been there for people, and that's been the biggest crux of it all. And the other thing is as well is that while I do say it is underfunded, throwing money at a problem doesn't always solve it. And the other thing is as well is that a lot of money is paid on consultants as well. A lot of money is going to get paid on consultants, and even if this goes in, even if they push this all through and it stops them from striking, it's not going to fix the problems with the NHS. There are still fundamental problems within the NHS. Even when there aren't strike days happening, people are still getting such insane waiting times to see a doctor. It hasn't changed. It's not going to change anything. This is at the fault of the Conservative government, and they're sitting on this. And the more they sit on this, the more it pushes people out of the NHS into private care, into making you pay for your treatment. When we already we all pay into a national contribution, the national insurance pot. Everybody pays into this tax, and everybody gets free healthcare as a result of it. It's a great system. It's always been a great system. And the problem is they don't want it done that way. No. They want it coming straight out of your pocket instead. And it's a terrible idea. Just ask those in America. So, forcing some medical staff to work through the industrial action under new anti-strike laws could end up harming patient care, hospital trust leaders have said, as ministers claim their new measures will keep public services running over Christmas. NHS providers, which represent hospitals, mental health and ambulance trusts, said there is significant risk that it would damage relationships between staff and employers that are already very challenged in a way that could affect patients. In a submission to the consultation on minimum service levels in hospitals, it said, our key concern is that rather than strengthening services as intended, the legislation proposed would worsen relationships between employers and staff and between trusts and local union representatives to the long-term detriment of patient care. NHS providers also highlight the government's own assessment showing that it would be more financially costly than alternatives. Its verdict was published as the government sets out guidance to employers on how to issue notices to staff under its new legislation. The TUC, the organisation body for trade unions, said the laws were designed to escalate disputes, not resolve them. It says the new guidance, along with the statutory code of practice, makes an already dire piece of legislation even worse by trying to wrap unions and employers in red tape. Yeah, that's essentially what they're trying to do. They're trying to deny the right to speak. The government has already laid regulations for minimum service levels in rail. the ambulance service and border security, which will come into force by the end of the year. It follows the introduction of the Strikes and Minimum Service Levels Act this year, which faces fierce criticism from trade unions as unworkable and a threat to the right to strike. In rail, minimum staffing levels will be 40% during a strike, while the border force minimum service level will be required about staffing about 70 to 75%. Under the rules for ambulance services, they will be required to make sure all 909 calls are answered and triag, basically going to say responded to, and all calls responded to in life-threatening circumstances or where there is no reasonable clinical alternative assistance at the scene or transport to hospital. Ministers are also consulting on rules affecting workers in hospitals, schools, universities and fire services. It would mean that when workers vote to strike, they could still be forced to attend work and sacked if they do not comply, while unions could face hefty fines if they cannot show that they have certain members to attend work during strike periods. Paul Nurek, the TUC General Secretary, said measures would only poison industrial relations and worsen disputes. He said the draconian legislation represents a brazen attack on the right to strike, that unworkable, undemocratic and likely a breach of international law. At the same time, ministers are trying to overturn the ban on the use of agency workers during strikes after the High Court said in the summer that the practice was unlawful. Kevin Hollenrack, a business minister, said the ability to strike needs to be balanced by ensuring people continue to have access to essential services. And businesses should also not have their freedoms restricted by burdensome regulations that aren't justified, which is why we are seeking views on removing such unnecessary rules so businesses are able to decide for themselves what staffing is required. But the thing is, guys, is that we need essential services, but the problem is they're not even essential now. That's the thing. The services aren't even there now. Never mind when strikes are happening. They're not even there now. The public know that services aren't there now. And the thing is that even if you take them back to work, even if all the strikes completely stop, it's not going to fix the problem. It's not going to fix the crux of the problem. They won't fix the solutions. And rather than fix the solutions, they rather make things worse for people. They're trying to take away people's rights, essentially. The right to speak, the right to strike, the right to process. They're just trying to take all these rights away from us. And I just don't understand why they just won't get around the table and just talk to these people, and they just won't do it. They just won't do it, and they keep arguing that inflation is too high. The argument is always that inflation is too high, so we can't give you this such pay rise or that such pay rise, and it's just and yet they manage to find funding elsewhere for other toys and programs that they want to invest in, and yet they can't find the investment for ordinary working people. It's always whatever benefits them. It's never whatever benefits the needs of the people. It's always the party first, never the public. The public always comes second. And I'd like to hope that Labour will put the public first when they come into government at the next general election, cross fingers anyway. But as of right now, it's just despicable the way the Conservatives are handling all of this, that is for sure. Well, what do you guys make of all of this so far? Do you think it's going to cause more harm than good, these anti-strike laws? And the fact that they're discussing it about potentially out-branching it, not just from healthcare, which is already in rail, but in other industries as well, to make it even more difficult for people to be able to strike, to be able to speak their mind, per se. Let me know what you guys honestly think in the comment section down below. Hit the like button, share across social media, and hit that bell notification icon so you'll be notified when I upload another video. And if you want to financially support me, you can buy me a coffee. That is also in the links down below. Thanks for watching, and I hope to catch you all very, very soon.